We are a few weeks now into 2024, and how many of you have kept your New Year's resolution to become healthier? If you're maybe falling off the bandwagon, it's not too late to get back on. This morning in the sponsored segment, physical therapist assistant Amon is back from Advanced Physical Therapy Center in Davison to help us out. Good morning, Adam. Good to see you.
Nice to see you.
Yeah, so let's start with those goals. How do we stay goal-oriented and focused?
It has a lot to do with setting achievable goals. We don't want to say, all right, I'm going to bench press 100 more pounds this year. We want to keep it more time frame oriented. Suggest 2 weeks, 4 weeks. Maybe a longer term goal would probably push into 6, where you can see easy, trackable documentation that would show you are improving in a lot of different ways.
Yeah, so don't bite off more than you can chew.
Correct.
Yeah, okay, so you suggest also documenting your workouts. Why is that so important?
Because you can't see where you're going unless you know where you've been. When you write things down initially the first time, you take a look at what you've done and you say, okay, I have progressed in these exercises. I have gained weight or strength in these exercises. But it also helps you to keep a reasonable time frame for these things. If you go out there and say, I'm going to lose 10 pounds in a month and you don't achieve that, it knocks you down a little bit. But if you do keep it to, I'm going to lose a pound in 2 weeks, that is fuel for continuing going. So keeping track of these things is a good way to look back and to motivate yourself to go further.
Yeah, writing it down gives you that good visual. So you talk about holding yourself accountable as well, but how do we really do that and stick with it?
That's tough. Motivation is number one. Finding your own motivation. I like to call it manufacturing your own motivation. It's very difficult to do, but what you have to do is do it for you first, and everything else is secondary. How you look to somebody else should never matter. It's how you look and feel yourself. We want to have the proper motivation going forward, and sometimes those outside factors aren't really the best for you.
Gotcha. And then, okay, we're talking numbers on the scale. A lot of people get hung up on this. I know people like seeing the scale number go down, but you say we shouldn't trust it. Why?
The scale lies a lot. Gravity is a funny thing. What you should be doing is focusing on your overall health. Yes, we want to lose weight, but there's other indicators of that. You could measure your blood pressure and start there. Heart rate is a very important thing. You can have a better resting heart rate, but it's also an achievable goal that you can take back to day one. My resting heart rate on this day was 68, now it's down to 60. And the lower heart rate will indicate a healthier individual depending on how low it goes,
Sure,
So.
well, and if someone's, packing on a little muscle, the number might go up.
Yeah.
What if we get sidetracked or maybe face a setback? You say, don't beat yourself up.
Yeah, you gotta be gentle with yourself. You gotta give yourself some grace, I think is what they would say. Everyone's going to face those setbacks at some point. That's just the nature of what weight loss or health is. You have to learn to roll with those punches. Every single day is going to be a different day, and every single day you're going to have different effort levels, and you will never have the same levels. It just doesn't exist. You're not a robot. So every day give your best and be gentle with yourself if you miss out on those days.
Well, speaking of that, and this is where it comes into what you do for a living, what if we overdo it and we find ourselves in a little bit of pain from an injury?
So delayed onset muscle soreness, or DOMS, will usually take place about 3 days after a workout. And you'll feel all that soreness, and some people might call it pain. It's more discomfort. Pain, sharp pains, very persistent pains, those are things you want to, consult with an expert. You can seek your physician's advice, or you can just go, to your local physical therapy office or advanced and see if what they think, if maybe they have an injury that they could assess.
Okay, great information to keep in mind. And keep in mind as well, Advanced Physical Therapy has 9 locations across Mid-Michigan, and you can go to advancedphysicaltherapy.com to see those locations and request an appointment. Thanks for your time.
Yeah, thank you very much.
Yeah, good to see you.